Well, some of the things we need to do for our health are among people's favorite things to be doing, and one of them is sleep. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam, and I've been living with multiple sclerosis for 38 years. We've been doing a series of videos about things that we can do and conditions that we can be aware of that will improve our general health and well-being, improve our quality of life without necessarily requiring us to address MS symptoms per se or take any kind of hardcore medication. We've looked at supplements, we've looked at bone health, we've looked at exercise, we've looked at blood pressure. Today, I would like to look at sleep. I'm going to share some sources with you today that give some ideas about how we all might get better sleep. The first article that I looked at was something in the published scientific literature, Sleep Abnormalities in Multiple Sclerosis. And you can see there's multiple authors in Greece, Cyprus, Switzerland, and the United Kingdom. And I saw this on PubMed. I'm just going to read you just the abstract. The purpose of the review, they say, is to summarize the most well-documented sleep disorders seen in patients with multiple sclerosis, with a special focus on the impact on quality of life. Sounds like that's right up our alley. It says sleep abnormalities in patients with MS are a multifactorial and relatively complex issue affecting approximately 60% of the patients, while the pathophysiology of these symptoms is not fully understood. So in other words, sleep in multiple sclerosis is complicated. It affects more than half of MS patients, and why it actually happens from a biological level, not fully understood. So again, nothing really new there. Nothing much with MS is actually really understood. So nothing surprising with that. Circadian rhythm, which is your day and night cycle, circadian rhythm disorders and increased levels of pro-inflammatory cytokines have been recognized as potential players in affecting sleep homeostasis in MS patients. I apologize for all these big words, but it is a scientific paper written for other scientists, and that's their bread and butter. They see these kinds of words every day. I think it's pretty easy to figure out what they're talking about, though. Homeostasis is just your body reaching some kind of stable situation. Then they go on to say medication-related side effects, such as in immunotherapy and other factors, such as lesion load, can contribute to the disruption of normal sleep patterns. Most frequently encountered sleep disorders are insomnia, sleep-related movement disorders, sleep-related breathing disorders, and circadian rhythm disorders, affecting both adults and pediatric MS populations. Etiology still remains unknown, with treatment options focusing on behavioral cognitive therapy and lifestyle modification, including improvement in sleep hygiene as well as melatonin supplementation. Given MS prevalence is still rising, affecting millions of people, more personalized medicine applications should possibly form the key approach to improving patients' quality of life and quality years. So again, a lot of technical jargon there, and I will not read the paper itself. Instead, I thought we'd go out and look at a couple of sources that are very reputable, but speak in a language that most of us are more familiar and comfortable with. And the first one I thought we'd look at is the National Multiple Sclerosis Society, and they have an article on sleep as it relates to multiple sclerosis. As they say, quality sleep is important to maintaining overall health and wellness, but sometimes it's hard to get. Lack of restful sleep can cause daytime drowsiness and make some MS symptoms feel worse. Sleep difficulties are actually more common in MS than in the general population. As we saw in the other article, 60% of people with multiple sclerosis have sleep problems. I don't know what the percentage is in the general population, but according to this article, it's worse for people with MS. They say that sleep disturbance is a general term for a wide range of sleep-related symptoms and disorders and can include the following. So, you may think you don't have a sleep disorder, but maybe after reading this list, you'll decide differently. So here's what they say. Difficulty with initiating or maintaining sleep, also known as insomnia. And that's the one I think when we think of sleep disorders, that's what we think of. But it can also be difficulty with too much sleep, also known as hypersomnia or hypersomnolence. It can be uncontrollable lapses into sleep, also known as narcolepsy. So if you find yourself uncontrollably falling asleep at inopportune moments during the day, that could be narcolepsy. Sleep-related breathing difficulty, including sleep apnea. Abnormal movements during sleep, including restless legs or body syndrome. Abnormal behaviors during sleep, including acting out dreams or excessive daytime sleepiness, which is, I guess, different from narcolepsy because sleepiness is not the same as actually falling asleep uncontrollably. But the line is probably pretty fine. They have some interesting questions here about, are you sleep deprived? Let's go through those. It says if you answer yes to any of the following questions, you may not be getting enough good quality sleep. Do you feel sleepy, grumpy, or down during much of the day? Do you fall asleep as soon as your head hits the pillow? Do you sleep fewer than 7 hours most nights? Do you still feel tired even after having 8 hours of sleep or more? Number 3 is really my thing. I don't know that I get even 7 hours of sleep on most nights. I'm usually up by 3 o'clock whether I like it or not, and it really doesn't matter if I go to bed at 9 or at 10. I'm still up pretty early, and so what if I went to bed at 9 and I got up at 3, that's only 6 hours of sleep. Yeah, let me know in the comments if any of these describes the sleep problems that you've been having. Then they go on to talk about the causes of sleep disturbances in MS. They say sleep is impacted in a number of ways, including deficiencies in vitamin D and other nutrients that may help regulate sleep. And we did talk about vitamin D and other supplements in a previous video, which I will have linked below. Side effects of MS medications, including the disease-modifying therapies, corticosteroids, and stimulant medications for fatigue. So yes, that makes sense, right? If you're having a medication that increases your energy level, you might very well find that that's interfering with a good night's sleep. And you might have to talk with your doctor and make a decision about what's more important to you, not having fatigue during the day or being able to get sleep. They also talk about increased napping during the day due to fatigue, which may or may not really cause you to have problems sleeping. It really kind of depends on how you nap. Reduced physical activity due to fatigue and MS-related disability. Emotional changes, including stress, anxiety, or depression. That's a pretty common theme among all the sources that I looked at. Depression can cause you to have sleep problems. And again, as I've said in another video long ago, I talked about the fine line between depression and fatigue, that we often can't even tell whether we're depressed or whether we're fatigued, whether the fatigue is causing depression, the depression is causing fatigue. It's really pretty complicated. But at any rate, that can cause you to lose sleep or to have more sleep than you really want or need. Other MS symptoms, including restless legs, pain, urinary or bowel symptoms, and temperature dysregulation, those can all cause sleep disturbances. They talk about strategies to get the sleep you need. Tell your primary care or MS healthcare provider about your sleep problems because they may be able to advise you about something you hadn't thought about. It doesn't even necessarily have to be medication. There might be some way to change your patterns of living or behavior or whatever that will help you sleep better at night. Treat MS symptoms that may cause sleepiness. Consider the side effects of medications, as they've already talked about. Sleeping pills may be of some benefit, at least for a short time. However, some experts recommend taking them only as a last resort because they lose their effectiveness quickly and are potentially addictive. Almost all medications tend to lose their effectiveness with an individual over time. And the last thing you want to do is keep taking more sleeping pills because they're not doing the job. And then finally, cognitive behavioral therapy can help with insomnia. And then they talk about the steps you can take to improve your sleep quality. First one is to go to bed and get up at the same time every day. We've talked about that before in relation to other things you can do to improve your general health. And no more than 1 hour later on weekends. Regularity helps set your biological clock. Clear your mind before bed. Do you rehash the day's problems or worry about tomorrow once you are in bed? It may help to write a list of today's worries and things to do tomorrow well before bedtime. I think, making your to-do list or whatever long before you're actually ready to go to sleep does help. There have been times when I've done that. The other thing that happens is, sometimes you wake up in the middle of the night and you start stewing over something. Sometimes I've just gotten out of bed and jotted a note or two to myself or whatever. It's nothing that's going to really keep me up very long, but it gets it out of my mind, and I know I'll be reminded of it in the morning when I can take care of it. Plan your exercise to occur about 4 to 6 hours before bedtime. Exercise is a stimulant, so don't exercise close to bedtime. I guess that's another argument for doing your exercise first thing in the morning. Limit your caffeine use to the morning. Well, that makes sense. Limit alcohol use, particularly within 6 hours of bedtime. That may not be as intuitive because alcohol is a depressant, and you might think that that would help you sleep. But what it can do is cause you to fall asleep quickly, but then wake up and then be wide awake. Quit smoking or using other tobacco products. In the meantime, limit nicotine use close to bedtime. And they go on to say, create a bedtime ritual to signal the body and mind to slow down. Change into pajamas, wash up, and brush your teeth at least an hour before sleep. In that last hour, wind down by listening to calm music, reading, or writing in a journal. Don't drink a lot of fluids just before bedtime. Urinate before going to bed. I can't say that I've been flawless about that, but I think that is a very good idea. Make sure your bedroom is cool, quiet, and dark. We just talked about this in my last video, that the importance of having a good sleeping environment, one that works for you. The temperature should be cool according to them, and it does work for many people, including me, but I think it doesn't work for everybody. Some people have a hard time getting warm, so really feeling warm and snuggly is the thing that you go for, at least in the colder months outside. Try a relaxation technique that you like, such as breathing, imagery, or muscle relaxation once the lights are off. Use your bedroom for sleeping and sex only. Don't read, watch TV, use your mobile device, or talk on the phone in bed. Well, okay, I'm guilty of that. I'm guilty of most of those things. We do not have a television in our bedroom. I would advise against that. But I have read. Oftentimes I read until I'm so drowsy I can't read anymore. I start thinking I'm reading, but I'm actually making up my own story. And I find that I keep doing that. I think, well, it's time to give it up and go to bed. I don't usually use my smartphone at bedtime, but I have occasionally been on the phone with somebody, not right before I fall asleep, but close. So yeah, all these are good advice, and I think maybe I'll try harder to not do some of these things that I just said that I was doing. If you don't fall asleep within 15 or 20 minutes, get up. Don't stay in bed and watch the clock. Do something boring and relaxing, read something light, or watch an old movie. I honestly don't know whether that would work for me or not. If I get up, then I'm up. My brain kicks into awake mode very easily. So I'm not sure this would work for me. I don't know. You can let me know. Is this something that you've tried and that has worked for you? Getting up to make a note is kind of an act of desperation. I talked about that earlier, that if there's something I'm stewing over, I'll get up and jot myself a note. But that is, like I said, desperation, because I know I'm not going to fall asleep if I'm still going to be stewing over that thing and trying to solve the problem all night long. But I make that as short as I possibly can. And then finally, manage your mood. Talk to your healthcare provider if you've noticed any emotional changes. Well, that's important because that can affect not just your sleep, but many other aspects of your general health. And then finally, their summary is that assessing your sleep is the first step to identifying sleep-related problems and/or clinically significant sleep disorders. Before your next medical appointment, it may be helpful to print the questionnaire found in this professional paper and bring your responses with you to your healthcare provider. Well, let's click on that link and see what our professional paper tells us. What is it? Where does this take us? So here's the paper. We don't need to go through the whole thing, but it's a questionnaire on sleep disturbance and multiple sclerosis, put together by the University of Washington School of Medicine. Yeah, there's a number of categories here that you would look through all these bullet points and then make a note if any of these apply to you. Secondary effects of common MS symptoms, side effects of MS medication, effects of stress and anxiety, effects of depression, changes in sleep hygiene behaviors. So all of this you can go through and then see if there's some things here you can talk with your doctor about. That's probably very useful. Now here they go finally, after all the intro stuff, they get into the questionnaire. And they ask you questions like, how long on average has it taken you to fall asleep? And how rested on average did you feel upon waking in the morning? So again, you might want to just fill this out and take it with you to your doctor if you're finding that you're having sleep problems. The next site that we can look at is Very Well Health. They have some good advice. And as I went through this article, I noticed that there's commonality with the article we just looked at from the National Multiple Sclerosis Society, but these folks also have some other tips and observations that the other article did not discuss, and so I thought it might be worth looking this over a little bit. How to improve your sleep habits. And this is from 2021. They start out with posing the question, what is wrong with my sleep? We have an expectation of perfect sleep, that we will crawl into bed, fall asleep within minutes, sleep without interruption, and awaken fully refreshed and ready to start our day. But is this a reasonable standard? I think most of us can remember a time in our lives, certainly when we were children, most of us slept pretty well. But as we get older, or as our MS starts taking over, we often have sleep issues. As they say here, children are often hailed as a model of perfect sleep because for the most part they are able to do just what we've described. But as we mature, our bodies change and our sleep seems to likewise deviate from the ideals of childhood. Life, in a sense, gets complicated. There are new time pressures, our sleep is disrupted by others, including bed partners and our own children, and oh yeah, they didn't mention pets, but pets also, and other health problems such as nocturia, which is having to get up and use the bathroom, heartburn, and even pain compromise our sleep. As we get older, we may need less sleep, with adults over 65 requiring just 7 to 8 hours on average. Well, that's comforting to know because I don't sleep long hours, as I've said earlier. And so maybe, I'm not 65 yet, but I've been precocious for most of my life, so I guess I'm just continuing that. I thought this was interesting. They say some of our expectations regarding our sleep might be slightly misguided. As an example, the thought that we will fall asleep almost immediately upon retiring to our beds may be improper. It should normally occur in less than 15 to 20 minutes, but it may take longer as we get older. In fact, people who fall asleep in less than 5 minutes may be pathologically sleepy. This means that they are so sleepy that they fall asleep quicker than might be normal. In some cases, this ability to fall asleep quickly and enter rapid eye movement sleep quickly can be seen in excessive daytime sleepiness that might occur in sleep deprivation or narcolepsy, as the other article talked about. Some sleep researchers believe that it might be normal to be awake some during the night. The fact that you sleep straight through the night without budging may again be a sign of inadequate time spent sleeping and increased sleep pressure. This phenomenon of being awake at night is called quiet wakefulness and is often observed when the sleep habits of non-Western cultures are studied. So apparently Americans may have an idea of this like ideal sleep state that isn't the standard for people in other parts of the world. When people sleep in a group in close quarters, there is more time spent awake during the night. This makes sleep a more fluid concept. Time may be spent chatting, eating a snack, or engaging others around you. In history, fragmented sleep with periods of wakefulness in the middle of the night was common, reflected in the midnight adventures seen in the plays of Shakespeare, for example. I have not done much chatting in the middle of the night, although I have a friend who does that. She and her significant other, they have long conversations sometimes in the middle of the night. They don't seem to mind waking each other up, but it sort of depends on your partner. If they are heavy sleepers, or they really need their sleep, or they don't easily transition from sleeping to wakefulness, they're not going to appreciate you wanting to chat with them. And that might be you. You might be the one who doesn't really appreciate being wakened in the middle of the night just to chat. They conclude this section saying that it actually may be normal to wake up at night. When we find ourselves waking in the night, no matter the cause, we may conclude that something is wrong. If there are no consequences in daytime function, however, this may not be the case. It is normal to wake, to roll over, adjust the covers, respond to noise, and maybe even to get up to urinate. Waking to go to the bathroom is so common as we get older that you would be hard-pressed to call it abnormal. I am so glad somebody said that, because I get tired of hearing about that, well, you should sleep through the night and not have to get up and use the bathroom, and if you do, then there's something wrong with you. I'm sorry, but in my adult life, that has never been the case. And I don't think that has anything to do with MS. I just think that it only makes sense, right? I mean, during the day, you're going to the bathroom multiple times. Nobody says anything's wrong with that. Okay, that was my rant. Sorry, I'll get back to this. Many people get back to sleep easily and are unaffected. The problem begins when our poor sleep compromises our lives. If difficulty falling or staying asleep at night begins to have consequences, there is a motivation to seek the cause. In their next section, they talk about common causes of difficulty sleeping and insomnia. They say here that the most common reason why you can't sleep is also the most obvious. You are not tired. Your desire to sleep will be greatly diminished if you are trying to sleep at the wrong time. Imagine lying down 3 hours before your normal bedtime. The chance of you being able to fall right to sleep is pretty slim. This has to do with the circadian rhythm of our bodies. We talked about that in the other article. This system helps to coordinate our activities, including our desire for food and sleep, to the external environment. Problems with the timing of sleep may occur in the circadian rhythm sleep disorders, as well as in temporary conditions like jet lag. It also, I think, accounts for why daylight savings time is so hard on people, because it does mess up your natural rhythms that you've established for 6 months during the regular standard time. And if you want my opinion, we ought to just get rid of daylight savings time. I have a video on that too, which I can link below, but I find that it really causes a lot of problems for people, including people who don't have MS. And here they say a very common cause of sleeping difficulty relates to stress and the intrusion of stimulating substances and activities. You may have trouble falling asleep the night before a big test or presentation. In periods of emotional stress, such as after the death of a loved one, you may also have trouble sleeping. This is called acute insomnia. It usually passes when these stressors resolve. Similarly, stimulants such as caffeine and even nicotine can disrupt your sleep. And again, they talk about having light at night from a TV or a computer screen might make it difficult to fall asleep. And also late night exercise, as we've talked about before, that is a stimulant. You don't really want to be exercising late at night. Maybe a walk around the block is fine as long as it doesn't cause you to have your heart rate go up. It might be just fine to do that, but don't decide that that's going to be when you're doing your hardcore aerobic exercises. And then it says that for those who have chronic insomnia, the bedroom space may become a trigger for insomnia through conditioning. The sleep environment is meant to be comfortable and facilitate sleep. It should be cool, quiet, and free of distractions. Ideally, you would not allow a television or pets in your bedroom. Well, you can tell my dog that. I don't think that she'll care. Bed partners may be disruptive, and some people choose to maintain separate sleep spaces for this reason. I've heard some folks say that their partner snores so loud that they're forced to sleep elsewhere because they just can't get sleep if they don't. Another common cause of difficulty falling asleep, they say, is the activities that precede your bedtime. If you eat or drink too late, you may suffer from heartburn or frequent nighttime trips to the bathroom. There are general guidelines to improve sleep, and we've already gone over those, so I won't click on that link, but I'll post this below and you can click on it if you wish. Many of these are meant to reinforce positive sleep habits. You should go to bed and get up at the same time every day. Irregular sleep schedules may set you up for sleep disruption. You should follow a bedtime routine, including quiet, relaxing activities to help transition to sleep. If you fail to unwind prior to bed, you may find yourself struggling to drift off to sleep, and that is totally no fun. Finally, there are medical conditions that might be keeping you from sleeping well at night, including heartburn or pain. There are also multiple sleep disorders that might cause difficulty sleeping. Some of these include insomnia, sleep apnea, restless leg syndrome, circadian rhythm sleep disorders, and all of those are hyperlinks. I've linked the article below so that you can find this. You can try some home remedies when you can't sleep. They say that for those who have difficulty with insomnia, there are a handful of options to help you sleep. One treatment option is sleep restriction. This involves limiting the amount of time that you spend in bed, often 7 to 8 hours, so that the time you are there, you are more likely to spend asleep. It can also be useful to observe a behavioral change called stimulus control. Stimulus control helps break the association between your bedroom and not being able to sleep. That's interesting, isn't it? They've got a hyperlink there that you can look at. Why don't we click on that and just see what it tells us about stimulus control to improve our sleep? Treating insomnia with stimulus control conditioning. Let's see what it has to say. We won't go through the introduction, but here are the tips. You should spend no more than 20 minutes lying in bed trying to fall asleep. If you cannot fall asleep within 20 minutes, get up, go to another room and read or find another relaxing activity until you feel sleepy again. Activities such as eating, balancing your checkbook, doing housework, watching TV, or studying for a test which reward you for staying awake should be avoided. Interesting, yeah. So you got to find something boring to do, or maybe just something kind of mindless. Maybe a jigsaw puzzle. They haven't mentioned that, but you could go maybe work on your jigsaw puzzle. I wouldn't recommend starting one, but if you've already got one on the table and you could just go and work on it for a few minutes until you get sleepy again, that might be a good thing to do because it doesn't really get your mind going. I think what they're saying here is anything that engages your mind, you don't want to get into that. I have a friend who crochets. Maybe that would be another thing you could do for a few minutes until you get tired. So then when you start to feel sleepy, you can return to bed. If you cannot fall asleep in another 20 minutes, repeat the process. Now I could see where you could get yourself set up to be so anxious about, oh no, it's been 20 minutes. I probably should get up. So try not to play mind games with yourself. I guess I'm preaching to myself here because I could see me doing that. I'd be thinking, oh no, I guess I'm going to have to get up again because it's been 20 minutes and I haven't fallen asleep. I guess if you can't relax, if you're really not that tired, getting up again might be the right thing to do. So set an alarm clock and get up at the same time every day, including weekends. I think that's important for those of us who still work during the week and or have a different schedule Monday through Friday than we do Saturday and Sunday. It is important to preserve the same routine. And then it said, do not take a nap during the day. So contrary to everything my doctors told me in the past, just don't do that. I don't know. I think you could take a 10-15 minute power nap. It probably wouldn't hurt you. But they don't seem to make any allowances for that. In any of the articles I've read, the advice is very consistent. Don't take a nap during the day. I'd be curious to know in the comments if that is helpful for you and if there are any other conditions that you would like to know more about. Please leave me a comment. I'd be happy to look into it and make a video about it. I think by improving the general quality of our health, we will be better off. Our lives will not only be longer, but they'll be healthier and happier. And that is a good goal to shoot for, isn't it? Well, that's it for today. Take really good care of yourself, and I'll see you again in my next video.